Good morning and welcome back, everyone. Just about 13 minutes before 7 o'clock. March is Colon Cancer Awareness Month. The American Cancer Society estimates nearly 100,000 Americans will be diagnosed with colon cancer, new cases in 2014. And joining us this morning from Gunderson Health System is gastroenterologist Dr. Steve Schlack-Haerer. And Dr. Schlack-Haerer, thanks for joining us this morning.
Thank you for having me.
Well, we hear all the statistics about how it affects so many people. Just how dangerous? Can you give us some perspective of how dangerous colon cancer is?
Yeah, I mean, colon cancer is still the second leading cause of cancer death in both men and women, so it's really not an uncommon tumor that we run into. The importance is when we catch it early, it oftentimes can be fixed, but the main thing is prevention. Colon cancer typically starts out as precancerous lesions called polyps, and if we find those early, we can take those out very easily and prevent colon cancer to begin with.
You mentioned that it affects both men and women, but does it target one gender more than the other?
No, it's about equal.
Okay. When should somebody start the screenings for these polyps?
Yeah, average risk individuals with no family history of colon cancer or precancerous colon polyps generally start colon cancer screening at age 50. If people are having symptoms, which can range anywhere from a change in the bowel pattern to blood in the stool, unexplained weight loss, abdominal pain, they should be screened earlier. Or if there's a family history of colon cancer or precancerous polyps, then we generally start colon cancer screening starting at age 40, possibly earlier depending upon the age of family members and the symptoms associated. The important thing is, though, which I think is probably the biggest mistake that people generally make, is they say, well, I'm not having any problems, I don't have any symptoms, I don't need to get screened unless I have a problem. And colon polyps, and certainly even colon cancer as well, is frequently without any symptoms at all. So screening is so important. The time it takes to grow from a small polyp to a colon cancer, we think is on average about 8 to 10 years. So there's really a very wide window of opportunity to find these precancerous lesions and remove them before they ever have a chance to develop into cancer.
Say someone is diagnosed early, what are the treatment options and then the outlook for that person?
Well, if we catch it earlier enough, depending upon the lesion, sometimes it can actually be removed endoscopically. But typically, surgery is necessary, removing that section of the colon and sampling the local lymph nodes at the same time. If there's no evidence of spread outside of the wall of the colon, that may be all that needs to be done. If there is spread outside of the colon, just to the local lymph nodes, then we need to talk about things like chemotherapy and other modalities. But again, catching colon cancer early can mean all the difference between long-term survival and not.
Well, we are out of time. Thank you for joining us, Dr. Schlack-Haerer. And important to emphasize just yet again that it is always important to get screened whether you have symptoms or not.
Absolutely. Thanks for having us.
All right, thank you. And stay with us.